Welcome to MediaPharm, health information with a personal touch. I'm Dr. Dean Elbe.
A colleague who was 5 months pregnant asked me if it was safe for her to have a local anesthetic to freeze her jaw so she could have dental work. Stay tuned to learn more about the answers we found. If it's not an emergency, most dentists prefer to do dental work requiring a local anesthetic during the second trimester of pregnancy or wait until after the baby is born. Here's why. In general, the time of greatest risk for damage to an unborn child from exposure to any drug or toxin is during the first trimester of pregnancy. Later on, the risk of a drug harming a developing fetus is lower. Still, birth defects can happen even when there is no known exposure to a drug or toxin during the pregnancy. The U.S. Food and Drug Administration rates the risk for every medication during pregnancy with one of 5 letter grades: A, B, C, D, or X, kind of like a report card. Grade A drugs are proven safe for use in pregnancy, while grade X drugs should never be taken during pregnancy. The risks with other letter grades fall somewhere in between. The amount of local anesthetic drugs such as lidocaine injected for freezing are usually small, and lidocaine has a grade B rating in pregnancy. This means it is considered relatively safe, but controlled studies in pregnant women to prove its safety have not been done. Why not perform the dental work during the third trimester? Well, laying on your back in the dentist chair for long periods of time late in pregnancy can be very uncomfortable for mothers and could place excessive pressure on the uterus or cause unwanted blood pressure changes in the baby. Dentists sometimes combine adrenaline with local anesthetics to make the freezing last longer, but it isn't a good idea during this time since the uterus is extra sensitive to adrenaline and exposure could lead to premature labor. If you're pregnant and needing dental work, you need to consider the potential benefits of having dental work without delay. If your teeth are hurting you, if you're at risk of an infection, or you are unable to eat healthy foods, these are also risks to your baby. The second trimester time frame for dental work is not a hard and fast rule. See your dentist and get advice on what risks and benefits mean for you. Once armed with good information, you and your dentist can make a decision together about the best time for you to have dental work done. This has been Dr. Dean Elbe wishing you well from MediaPharm, health information with a personal touch.